welcome. Thank you for being here today. I think we have a really neat program for you today. I think, again, it'll resonate very much with everything else that we've been talking about here when it comes to Lean Six Sigma, as well as project management here, and how do we maintain focus on projects after we've done the implementation, or maybe even during the implementation. So we're lucky to have Stu Cox with us today, who's going to take us through this Lean Daily management, and also he's developing a course actually for that too. So we'll talk about that. Before I turn the reins over to Stu, and I guess she may not be coming in, but Sherry Marshall, who's the president of the Workforce and Investment Board in Hamilton County, was going to try to join us, but apparently that's not going to happen. As you all know, and you know, you've heard it from me several times, there is a real push lately to not fund these types of courses, specifically in, I'll say, in Ohio. I'm sure it's in other areas too, but specifically in Ohio. And unfortunately for us right now, Hamilton County actually, after their audit, made that determination. So Hamilton County is currently not funding these our courses, not just our courses, but any courses in Lean Six Sigma, project management, and so forth. So there's obviously that's alarming, and especially given what's going on now, and in the funding of professionals. So what she was asking, we only had a week up front, and now they've kind of extended that, is if you know of anyone who may have tried to get funding through Hamilton County and weren't able to because of this determination, we want to hear from you. They were wondering if we can get a couple letters. We don't need 20 letters, but if we can get 4 or 5 talking about the situation, where people had approached us, or obviously Hamilton County, or other counties, to where they were turned down because of the current determination, and what transpired from there. So again, if you know of anyone, have them send. I mean, again, it could be an email, a letter. They could send it to my attention. We're going to try to get some of those together, and then present those to the state, actually.
Hey, Tassos?
Yes.
I would be happy to send a letter. I mean, my working with you guys over a year ago helped me get my job. Having the Lean Six Sigma certification, which was a program paid for by Hamilton County.
Right.
Company Epic is all about
Definitely.
Six Sigma. So I could definitely put together a letter that talks about how this really, got me.
No, and we're happy to receive those letters as well. They wanted to, they want to target them just to show, look, here are the people who you didn't fund. Obviously we want to hear about the people who didn't fund it, because again, the outcomes are important.
Yeah.
But the other side of that is, why, these are people you didn't fund, and here's where they come from. This is what they were doing, and these were the careers that they had. So why is it? And then really, the letter of the law is not meant to try to bias who gets funded. If you're a dislocated worker, and that's what Hamilton County and a lot of the other counties have been saying. Look, if you're a dislocated worker and you fit that definition, then the funding should be open to you. But unfortunately, in many cases, it's not. So that's that's kind of what she wanted to talk about. But if you have any questions, like I said, feel free to give me a call. More than happy to discuss that a little more so. But if indeed you'd be open to drafting a letter, we'd be more than happy to receive it. So thanks again, and we can talk about specifics if you like. Okay. So thank you again. All right. I'll get off my soapbox. So I'll turn it over to Stu Cox here. Stuart, first of all, has a great experience both in the food service arena as well as healthcare. He also is a former student of Breakthrough Performance Group. So again, he'll talk a little bit about how he's used a lot of these tools, but also then in terms of how do we try to maintain focus on these improvements. So as we all said, and I really liked Karen had a session back in the day about the control phase, and why organizations don't really follow through in the long term in many cases, and why projects fail. And a lot of times it is due to the lack of focus there. We have too much going on. We have too many other projects, and maybe not enough resources. But also maybe we lose that drive from our leadership to maintain that focus. So I'm going to turn it over to Stu, and hope you enjoy the session, and then we'll have some questions afterwards. Okay. So Stu or Marcy, do you want to make him a host so he can kind of go through his thing?
I think I think he's fine. We did a dry run before.
Oh, okay, great. All right. Well,
So,
I'll turn it over to you.
okay.
You, Stu.
Am I sharing at this point? Do you all see my screen?
Yes, we can.
Okay. Good deal. Well, just let me give a quick overview. Tassos mentioned I've actually had worked in the food service industry for 30 plus years. And then the last 5 years, I actually spent in healthcare as a director of clinical project management for a Baptist health system here in Kentucky. And it's probably kind of an odd combination of food service background and healthcare, but to be honest with you, there's a lot more similarities. I can't tell you how many times I was able to implement hand hygiene and sanitation programs in the food service industry. And first thing I do when I get involved in a clinical project area within the healthcare was, guess what? Hand hygiene. It's a mission critical to quality area of improvement. And so there's a lot of things that have gone into my experience from both those arenas. And as I've talked with Paul and Tassos, there's one of the things that I've come back to in my career a lot, and we find a lot of individuals in the continuous improvement and project management professions find is that you have with lean, with Six Sigma, your define, measure, analyze, improve, control phases. And of course, in PMP, your initiate, plan, execute, monitor, control. And so, a lot of overlap between project management and continuous improvement in finding improvements or implementing programs or solutions, but then sustaining the benefits and results for the long term. So this is just a little preamble here that the control phase is considered by many to be the most difficult step in Six Sigma processes, because it's difficult for many organizations to maintain that focus on past implementations due to having fewer resources and more projects in the works. Lean daily management identifies and monitors those strategic metrics, facilitates routine leader team communications, tracks ongoing business solutions, the implementation plans and results. Essentially, in your control phase, it's a discipline and a process to help make sure you deliver and sustain the benefits that you work so hard for, whether it be in improvements through a Six Sigma process or through just straightforward implementing processes, programs, workflows, solutions. I'll give a couple examples because my most recent experience has been in the healthcare area. But the one thing I want to make sure to before we go on is to reinforce that especially as I've talked with Tassos and Paul about the lean daily management and its applications, um, it's not just, there's a lot of core experience out there in the manufacturing and industrial areas, but in the service areas and then in other business areas, there are so many examples. You can go out on the internet and do searches on your own through Google and look for some opportunities to see examples of how this was applied. But in my healthcare experience, I had an opportunity to work very closely with the Joint Commission, which is an accrediting organization recognized by the U.S. government, by the Centers for Medicaid and Medicare, by the healthcare industry. They do a lion's share of the work going out and evaluating hospitals and providing the certification and the credentialing for those hospitals. They have a very strong feeling about the importance of high reliability and the utilization of Lean Six Sigma tools in their domain for healthcare. And particularly, there's a study I ran across from back in 2018 that the Joint Commission conducted. And this summary here is very telling. A majority of hospitals have adopted lean-based transformational performance improvement, but with wide variance in the degree of implementation. And I think we all run into this with Six Sigma and the project implementation programs we're involved with. It takes time for this to gain traction. The length of time doing lean is positively associated with the implementation progress and reported positive performance impacts. Importantly, the maturity, the leadership commitment, daily management use, and training were major factors associated with the positive performance outcomes here. I put in red that maturity piece because, again, it takes time for this, but the leadership commitment is absolutely a critical factor in ensuring success in implementing improvement programs and sustaining those results. Just a quick overview of the lean definition. You guys are well familiar with this. The ASQ definition. Lean is defined as a set of management practices to improve efficiency and effectiveness by eliminating waste. The core principle of lean is to reduce and eliminate non-value adding activities and waste. So throughout this discussion about lean, I'll toss out terms that you guys, I've actually left a couple slides out of here that, for other audiences, that's where we cover some of the basic definitions of language in that. But, here, a lot of talk about what is the critical to quality work? What is the voice of the customer? Who is the customer? Is it an internal or external customer? And then assuring, the workflows, that you've identified the solutions properly so that there's alignment throughout the organization on improving. Lean daily management is the system that allows you to deliver customer value through proper support and leadership to those who are closest to the process. So creating a problem-solving culture that drives improvement. That's what we would do through lean daily management. First off, aligning your employees with the leadership and the organization goals. I can't reinforce the importance of this because all the metrics that you select to track and discuss and communicate with your team members throughout the organization should vertically and horizontally go throughout the whole organization. You want to engage employees from grassroots to senior leader level. Establish daily monitoring, evaluation, and accountability where possible. Now, daily, in some cases, it could be hourly. In a manufacturing industrial area where you have actual work going on, there could be all the way from the hourly, daily, weekly, monthly, quarterly basis that you actually review and assess, discuss the metrics and how might you perform with your team. You want to focus on rapid problem elimination. So the idea, the old saying, what gets measured gets fixed. Well, what gets measured needs to be reported and discussed so that it can get fixed. So the idea is to not just set on issues or opportunities as they come up, but to move quickly into a problem elimination mode. Create opportunities to coach and mentor. This is where the whole change management elements, and I know this is part of the discussion that Tassos and Paul, weave into and integrate with the green belt and black belt courses within at Breakthrough Performance Group. But change management is a huge opportunity area that's bolted on to be sure that there's great communication, alignment, and facilitation of team members and leaders at all levels throughout the organization. I'll stop here real quick. Any questions about this so far? Okay. So what does lean daily management look like if you were to walk into any given industrial, commercial, service, healthcare, business, facility, administrative organization? These are just some photos of a couple of the traditional types of approaches to lean daily management and the Huddle board process, the Huddle process to bring teams together. Of course, in manufacturing, you'll see this at the line level. You'll see this in the Gemba, actually where the work is being completed. You'll see specific to that function or that specific line, what are the critical to quality metrics that tie into and support the overall production and meeting the customer's needs ultimately. On the right, it's an area where you don't think about the possible application as much, but in an IT intensive, or in for example, in the insurance industry, or in a call center scenario, lean daily management is equally as applicable. There are always driving metrics and opportunities to look for improvements and sustain performance in those areas. So the Huddle can look very similar, whether it could be in a dirty and dangerous manufacturing environment or in an office environment. There are opportunities, and the key thing is to do the Huddles regularly, to have the metrics updated and available on a frequent basis, so there's critical late breaking information available, but it gives the teams the ability and the platform to talk and to discuss and to identify those problems on a regular basis and take action. In the healthcare industry, I had the opportunity to be involved in many of these types of areas. I've seen lean daily management and Huddle boards applied throughout hospitals, so that it's from the C-suite where the executives are all the way down to the units, so that multiple shifts, multiple departments are all using the same approach to come together for a short, brief period of time, look at the updated metrics, have a discussion, and importantly, facilitate ideation. If there is an emerging opportunity or issue, take action, come up with ideas. If you don't have the solution at that point, assign someone who's going to take that on, who's going to take the role to go away and do a little bit of research, but come back to the group and formally present an idea, a solution, or an opportunity to be able to address the issue or a change in the metrics that may come up. You see a lot of variation in how this is executed too. On the left side, this med-surg unit, medical surgical unit in a hospital, they didn't have as much, there was more text-based. And you can see by looking at it, the whole opportunity with a Huddle board is to be able to walk up to it, immediately spot, are we good or bad? Are we on it or off it? Are we red or green? And then are there any trends? Are we getting, and if we are red, are we getting worse? If we're green, are we getting better? What exactly can we walk away with? So organization of these is a critical feature. And that's one of the things we talked about doing some courses on this in detail, are some techniques and actual practical ways to go in and actually design the boards and organize them so that you can have maximum impact. The information hierarchy I mentioned a minute ago, in the hospital scenario I worked in, we had Huddle boards at the executive C-suite level. You would actually have the executives that had goals for the hospital or the facility. And then even in a hospital system that has 9, 10, or 12 hospitals or 50 hospitals, you're going to establish goals and metrics for the system as a whole. So the whole idea, though, is you work down through a facility, through the departments, through the lines or units, if it's manufacturing down to the line or work cell level, if it's a hospital or a other type of business down to the unit level, but get down to that shift. You may have multiple shifts working on the same line. So when they're producing components or they're producing work or output in patient outcomes, or in a call center, in the number of calls made, the number of actual attempts of calls and the number of actual voice contact made, or the number of sales made through that. The whole point is the tip of the spear at the bottom is the customer or the patient or the resource that's been identified that will benefit from the workflow. So when you're designing your communication process and how you're going to look at your metrics throughout the organization, it's typical to take a look at opportunities at the strategic level. And as you move down towards the shift and then towards the actual customer, you actually become more tactical in those. And we'll talk about that here in a minute, some examples. But the idea being that at the top level, you want to do broader impact, that are in broader goals that are monitored. That could be your whole mission, your goal, vision for an organization. But there are tactical things that happen throughout deeper as you move down through an organization that drive those more strategic goals through action and results at the lowest levels. Again, the point being you want to drive value, and you want value-added activity that's driving value to outcomes that are positive for your customer or your patients. So you always want to be asking, are we focusing and working on the right things? And how do we know that? One other thing I just wanted to mention, you may have one facility or one location, but the idea would be that you tie together at a senior organization level, multiple facilities to bring together the same approach across each of those. And so when you go to a system level, whether it be a large corporation, I worked for KFC and Yum Brands and within that organization for about 30 years. And you can imagine when I started my career, I worked for KFC here in Louisville, Kentucky. And that particular organization grew over the years to become Yum Brands, which included Pizza Hut, Taco Bell, KFC, and then there were international and global divisions, Yum China, Yum India. So you can imagine these larger strategic organizations that made up the bigger whole. The goals at the top level at Yum, of course, are very strategic and are very, the target and customer there is Wall Street in a lot of cases, as well as driving, the value down at the bottom at the lowest level to the customers. So there may be multiple customers involved in determining your goal processes. I'm just going to share one example, Tasso. So I was able to go pull up for a large, significant hospital in Cincinnati and pulled up their Leapfrog safety score. I'm not familiar, I'm not going to go into this in great detail. There's just a couple of key things here, but this particular hospital is a significant caregiver in the Cincinnati area. Unfortunately, this hospital and this Leapfrog, you all can go out and look at this. You can just Google Leapfrog and then go out. You can look for hospitals in your own community, and you can actually look down to this level. You can find detailed level about their safety and quality records to get an assessment and really do a look under the hood at what's going on in that organization. This particular hospital, since 2017, consecutively twice a year had scored as a C-rated hospital. And in 2019, in the spring, they dropped to a D rating in the Leapfrog system. And in this particular chart, Leapfrog looks at basic categories for safety and quality: infections, problems with surgery, practices to prevent errors, safety problems, and then doctors, nurses, and hospital staff. That gets into your patient experience and interaction with the patients. Two things, I kind of wanted to tie this back to, when we talked about strategic versus tactical. If you were doing a lean daily management program, if I were going to work with and consult with this particular hospital, I would start with, what are the strategic goals? First off, you've been a C-rated hospital. you just slip to a D. We want to get back into the C zone as quickly as possible. But then longer term, why settle for being a C rated hospital when there are B and A rated hospitals? Should we not look for the underlying causes and the opportunities to elevate this hospital to a much higher level? Working down and talking about the tactical level, in this particular one, there's two areas that popped out right away, three probably, but practices to prevent errors down here had two areas where they declined and didn't report results, but they were all their other results were below the average for all hospitals that are included in the survey. So that's one immediate area that jumped out with some significant differences there, that they were red. Basically on this chart, they've got, you know, the best hospital score, the average hospitals, and the worst. This chart just compares them to the average. So anything that's red in the center column is below average. So you can see there up at the top under infections, MRSA, C. difficile, infections of the blood, and surgical site infections after colon surgery. They're not doing very well. They're well below average in results in those areas. So tactically, those are probably good areas in surgery and in their med-surg units to go look for infection control and then not making errors and mistakes in the surgical areas. Those are probably the two areas that I would start with first. They actually did pretty good here with problems with surgery. Overall, they had a few things there, but you can see down here, the doctors, for some reason, there's some med record issues. Doctors ordering medications through a computer. They are below average on that. Safe medication administration. That tells me they've had medication errors. And as a patient, that's again, the whole area of in healthcare of emphasis is on high reliability, just like what the airline industry does. We want to make patients better, but we don't want them coming in and walking away with an issue that they didn't have before that.
Hey, Stu, real quick, I was going to ask you, similar to what you just discussed, some of the issues and so forth in terms of how we look at some of the problematic areas and so forth, and how we start to set procedures. Is FMEA part of that discussion? Or, I mean, obviously, I know probably in some of the, let's just say, litigation type of situations, but what about similar to this, some of the everyday type of?
Absolutely. I mean, that's a whole area. We could go into a whole discussion about that. For example, that whole safe and medication administration, that tells me there's, communication about medicines, there's a communication issue. So you could actually take a whole failure modes effects analysis against specific tactical line items on this list. Infections, that's a huge one. You see a ton, and the good news about healthcare compared to other industries, you see an embracing and a lot of use of the basic tools of Lean Six Sigma. Initially sitting down a consultation with bringing together the parties involved. What was the failure modes effects analysis? Doing 5 whys, exactly what happened. Fishbone, the Ishikawa fishbone, a complete, robust, and doing it in a way, there's something within healthcare, they're very non-punitive response to error. They really try to bring together the parties involved and make it non-punitive of the whole breakdown, and to really try to look for, hey, we want to get better and improve here. But they call it just culture in healthcare. And but there's a whole emphasis of bringing it so that it's not threatening, and it gets people excited about potentially. And of course, it's never easy to admit as a facility a mistake, but I'm telling you, things happen with surgery. This particular hospital actually wasn't too bad here, but there's a lot can happen. Wrong site surgeries, retained foreign objects, again, infections after surgery. There's things that can go wrong, and there's usually something pretty straightforward that can be done to prevent this. And again, lean daily management would be a way, if you can get these metrics on a regular basis in front of the teams, combine that with the failure modes effects analysis, with the fish bones and all the data that comes out of that, pretty promptly going after trying to address individual line items, which then will roll up and hopefully affect the bigger picture. Is that all? The good question there, Tassos, because yes, that's the Lean Six Sigma tools are relative, and all the background that goes into this. Any other questions? Same. Well, it's this point because it's kind of a good summary point here.
I do have a question, Stu. I have some opportunity at my last company work with something like this before. This is kind of like a KPI, key performance indicator, or
Right.
KPM, key performance matrix. But I'm tasked to put visual graph charts on it. And I did it before on Excel, but wasn't really appealing to the folks out there, the tier 2 huddle, especially. Tier 2 are the people on the floor operation. They don't understand what is lean. What are you talking about, David? What is Six Sigma? They don't even have a black belt or white belt. So how do I translate this information to folks out there who are not familiar with lean concept? How do I visualize? This is great. I like the chart, but it's a lot of numbers here. What does it tell me?
So this one, again, I go back to this particular type of chart to help explain the vision, the system goals, the more strategic goals and elements. There's always tactically something that's driving. It's like when you do a 5 why, Tassos, right? You're going up and down the scale. Why did this happen? What's keeping this from happening? You look up and down. Why? Well, to drive that, why are we a D hospital? Which is a pretty broad question, right? Well, a chart like what I just showed gets you to that. And I don't recommend that chart I just brought up to be something you would use on your daily management. You're setting me up here for a great transition, because that's where I'm going to move next, is how do you begin to represent things at a more manageable level. But it's the communication. I think using this type of chart, the tip of the spear is the customer. And you want to drive value down, down, down. And it gets tactical. The closer you get to the customer, there's very tactical things that, so again, I know leaders get very frustrated. I've had this is a continual problem for me. They get very frustrated with specific, detailed, complex issues because they want to fix the bigger strategic issue. They care about changing that grade from a D to a C. Yet you find out, as a professional Six Sigma expert, you find out there is a major flaw in the workflow. There is a major process issue, and I found it, and it's a very complex problem that we got to solve. So how do you're back to your point, that's the change management tools and process. And if any of you guys have, taken any or been involved in any specific change management training, in that alignment with the leadership, building relationship building is a critical piece to build trust, and then to learn about their level of understanding in that. And then, but again, back to the kind of some of the things we said at the beginning, involving everybody in the whole crew. David, to this is a chart that I came up with specifically that I'll show you an example of on a board in a minute, but what we used when we had safety and quality and patient experience metrics, and that we created a chart like this that would list, in this case at a system level, by facility. These could be lines. This chart could be customized. In this case, this is an example of using a spreadsheet type application. But the whole point is, on a month-to-month basis, or a day-to-day basis, or an hour-to-hour basis, as you look at each facility, there's a goal that is clearly expressed. And are you red or green against that goal? And I don't want to get into too much analyzing the chart, other than when you walk up and you see this chart on the board, you can easily identify the facility or the line. You can identify what that goal is. You can see what the goal is supposed to be. Are we red or green for today or this month or this week against it? What's our cumulative year target looking like? And then down at the bottom is a system. How are we doing against this? And that could either be a trend chart or a control chart. Of course, there's a lot of arguments about, what would be best and most appropriate. But the idea is that you could easily walk up and see, are you red or green at that moment in time? And if you see for example, on that chart, if you see some rows that are continuous red, you start to look, well, is there a trend here? Is this something we need to go at? We should see, like, facility 6 has been green and facility 4 here has been green every month. But what's wrong with number 3 and number 5 and number 1? And these other ones have had a jump come up. So the whole thing about this this approach is to make it easy to interpret the status and drive conversation about if you see a trend or an issue emerging, get the team that's huddling involved in talking about it. In this particular case, there's a hospital example. I apologize, but this, again, a lot of this is translatable into the other areas. But in this particular case, the boards I worked with in the hospital scenario, we would have categories for safety, quality, patient, or that could be your customer experience, people and HR. Turnover is a huge opportunity. You see that on many huddle boards in many industries because your specific job turnover or the overall organization turnover, that is a huge challenge, especially with changes that have happened due to the business arrangement that we see today under COVID-19. Finance, business impact. Are we driving the sales? Are we meeting financial goals and opportunities? And then a section on the board for a whole point around facilitating improvement ideas, eliminating barriers, and tracking and supporting the requests that come in. Huddles enable and drive team dialogue and alignment. So David, this is the second part of the question. In addition to having easy to read, clear, red-green stoplight type charts that tell the story very easily, it's having all the team members, subject matter experts, administrative assistants. The more people from the team you have involved there, sometimes solutions come out of crazy places and from crazy thinking in that. So again, the bottom line is the specific results and issues that impact the customers and patients or your customer base. They need to be goal driven, and you need to involve as many of your team members as possible in that. Of course, identifying your barriers to success and asking your 5 whys are always going to be one of the best tools for talking through that. And then what is the business impact, the voice of the customer, and outcomes? Again, even if you can't get direct measurable sales metrics, or so for some reason something's not available, can you use SurveyMonkey? Can you use some way to reach out to your customer base and get real life feedback about how the performance is going? And I'm not going to go through all this other than it's critical, though, that you establish discipline. A lot of times organizations will start lean daily management, but then they drop off or it trails off. Consistency is critical. You want to post signage, you want to have a start out, you want to explain, hey, this is when you need to be here. Start on time, end on time, and do that consistently every day. Required attendance should be everybody in the unit or in the work function. There should be a huddle process leader, somebody who is designated clearly responsible for the lean daily management process. I like to call them a master chief and a crew chief. And of course, you've always got your sponsors and champions in the organization. That's your senior leaders. But you, for each board, want to have a crew chief who makes sure, importantly, that metrics and information is updated and groomed so that the board is fresh and always relevant. Again, you want to encourage all team members to actively participate and be involved and make suggestions. And something that works really well is these sessions. It's technically these huddle sessions should only last no more than 15 minutes. They should be, especially if you do them daily, they should be very topical in looking at the trends or the issues that are emerging. And but it's really helpful to rotate that duty. Who steps to the board and facilitates the discussion each day? And the more you share, the more you get different people involved in the process, you literally increase their buy-in as a stakeholder in the process as well. Action is important. If you see a trend, if you see an issue, assign it to somebody for immediate follow-up, taking responsibility, and then coming back with either an improvement solution or a recommendation for further escalation or a recommendation on what to do next. Most critically, at the bottom here, I can't emphasize this enough, is leadership support. Attendance, help, recognition, and encouragement is critical from the leadership. The most successful huddles I've ever been involved with, whether it be in the food service or in the healthcare area, your senior most leaders come periodically. They may not come every shift or every session, but they may once a week or once every few weeks or something stop in there and show interest and help to show that they're literally, it's important to them. So here's an example. This is the last huddle board that I was involved with managing, where you see the types of charts that I showed an example of. And under safety, there's different types of infections listed there. Under quality, readmissions, you don't want patients to come back. You want them to stay healthy and stay away. But if they come back within 30 days, guess what? The government penalizes you and your payers penalize you. So that's a quality issue. So in this healthcare example, there's a number of things that are safety and quality. You don't want to give them a hospital-acquired infection, etc. Patient experience, that's survey and feedback. That's where the customer feedback. So this is where you want to bring back that voice of the customer information as much as possible to talk about that. People, that whole section there that you see, and the people, that's all about turnover across the whole hospital system. First year nurses in this case, and then overall turnover in each facility. Finance, various finance return on investment from, actually we track return on investment from Lean Six Sigma projects on the board, in addition to specific hardcore financial savings that could be derived. Over down at the bottom and to the right, that's your problem solving section. That's where actually you facilitate, you see the note. We kept these magnetic clips on the board with note slips for improvement ideas. Anytime, it didn't have to be during huddle, anytime somebody could bring an improvement idea, post it in one of the sections that it applied to down at the bottom. And then during the huddle, we would process that idea, and it would either go into the new or in process category, or it might be declared this is just not unable to pursue at this time. Or we got to escalate this up to leadership to help us go after this one. This may take some time. So we actually would do, the triage of the ideas that would come up. One area, as I talked about those metrics, there's the categories I mentioned: safety, quality, patient experience, finance. But in Six Sigma, you guys have all been exposed to your measurement system analysis. It's critical that you take each of the metrics. So for each chart, David, this is another example of how to tie it back to each chart and each area of information. Make sure you go through a clear operational definition for that metric. And then who is going to own it? When are they going to get it updated? Where does it come from? Does it come out of a system? Is it external, internal? Any other details that are pertinent, and then what the target goal should be. So again, every metric that's on this board should have a line on this chart, and your crew chief and your huddle chief, they should manage this to make sure that there's always clear information, so that if a senior executive, somebody walks up to the board, and that's kind of the punchline of the board picture here, is that when you walk up to a board like this, you can see, hey, we got a lot of red in this particular metric for this particular facility. What's going on there? We got a lot of green. We're doing really well here. How do we take that best practice and apply that to another facility? And again, you want to make sure that it's clear. And again, kind of back to this whole, when you're again talking about our control phase, again, whether it is a Six Sigma improvement project or an implementation and control phase through a project management process, getting improvement ideas and getting information back to the team is absolutely critical on those ideas. So that's where you put together these idea slips, and then you just, what is the problem? What's your potential solution? What metric will this improve? And is the solution within our influence, or do we need leadership? So that, when people bring ideas, it's got some thinking behind it a little bit to help facilitate the process. My last slide here, I just, if you were going to consider doing this in your organization, these are kind of some overall steps you'd want to think about to apply Lean Daily Management. Evaluate your current state, capability, and your processes. Engage your strategic supplier partners, subject matter experts, and staff. What are the critical to quality opportunity areas? Ideation on your future state. So again, current state, future state, we're talking about the bigger picture goals, the strategic goals, and then thinking about down in those pyramid diagrams, down to the point of the spear, what are the tactical metrics that are going to be driving the outcomes and the performance we want to see. Establish development, transformation, and implementation plan. So gosh, we need to develop this huddle process, this lean daily management. We need to help transform our teams so that we can transform this business overall with it. But we got to come up with an implementation plan. This is not just something you throw up one day and you just ask people to come around. You think through the process of implementing so that it's impactful. You take it to your leadership, have them validate it and align with you that this is important, and then I suggest when you execute your vision for lean daily management, you do a pilot test first. This could be one shift on one unit or one line in a manufacturing facility or a particular department. But that one pilot test can help you to work out the kinks and validate the process. Get your leadership, invite them to be involved with it so that they see the value, and that could help create momentum and support that's required to then validate it for the whole organization and help you expand rapidly and move it out. So again, I mentioned what, my most successful versions of this I've been involved with were down to the unit shift level in a hospital, where it would roll up all the way through departments to the C-suite, so that the senior leaders would actually be doing their version of it on a weekly basis or a monthly basis. All right, that's it. So I just wanted to, is there any specific questions on lean daily management or the process itself?
I have a question.
Hmm?
What are the, I put it in the question section, so forgive me, but I came in late. Did you list the 5 whys, or would you mind just briefly giving those? What are the questions you ask for the 5 whys?
Well, 5 whys, typically in your whether you're doing a failure modes effects analysis or you're doing improvement solution finding, defining the problem itself. Your 5 whys is the continuous. Why did this happen? Why did this happen? Why did this happen? Keep asking your 5 whys to get to that to get to the root cause. That's the essential. What are the tools? Tassos, you got a comment on that? You're on mute. Tassos.
So the idea is here you have a specific issue, and so we want to address that. So I like to start with the fishbone diagram, Ishikawa diagram there. So we're listing all our issues, and then for each of those issues, then we start asking the question why. Why is this occurring? And generally, by the time you get to the 3rd, 4th, 5th, sometimes 6th why, we're getting down to the root cause. Okay, and we'll do this collectively with the team. So it's a brainstorming kind of activity, but it really starts to hone in on the specific issues that are driving our performance.
Yeah, so that whole I mentioned, in the just culture piece about bringing people in. When you're asking the 5 whys and that, it's also important. It's not an interrogation and it's not blame pointing. It's a structured process that's with a facilitator to help really look back at what's the root cause creating the problem, and then that will help when you go to your problem or improvement ideas. It helps to shape up and provide a better or an idea that's going to improve for improvement, that's going to have a better possible traction or better impact potentially on the organization.
Hey, Stuart, also just real quick, do you mind if we share your contact information? Some people had some other questions, if that's okay with you.
Yeah.
Okay.
Absolutely. And you know, Tassos, I would also wanted to just bring this up to everybody that I'd like you to consider writing back to Tassos too about, you know, there's an opportunity we've talked about potentially a more robust actually course around this, which would involve, you know, actual facilitation, going deeper into, you know, it's best to do this where you actually solve for a specific facility or specific company's issues, or your own specific issues you may have with a client or something. So just I'd like you to consider writing back to Tassos about interest you may have in, if this were the course offered around this, to go into the details a little more. And one thing I also wanted to mention is in this particular example that I shared here, this was a physical board. Literally, it's a magnetic, a 4x8 whiteboard that takes up an entire wall. And it doesn't have to exactly look like this. It's really about, you know, the mission critical to quality information being displayed. But, you know, there's opportunities to go with a SharePoint solution or with other automated solutions here. That would involve working with your IT, you know, professionals, and, you know, what other information systems might be available, but it doesn't have to be a manual type. So having said that, there's still a lot of proponents that I've met for lean daily management that feels that that physical touch, having people huddled at the board, you know, actually updating metrics and, you know, being able to talk with it actively there is a benefit. So, but this could be done virtually through a automated process as well.
I have a quick question. How do you avoid, if you go back to your Huddle board, how do you avoid listing too much information on it? Because I did something exactly like that. I use a frame ring binder at the front. I put the metrics, like where you have the red and green, and the graph underneath that. But I also include additional information in each one of the, we call these pillars in the column, your safety,
Right.
quality, education. These are pillars. So how do you avoid listing too much in? Because for engineers, especially for engineers, project manager, we receive too much information on a daily basis. So how do you be more specific? You know, what other thing you want to show? You don't want to show everything, right?
Right.
Once you want to know a particular issue, say, I want to look into the people likelihood to recommend, why is it all red? Say a CEO of the hospital comes in, why is this all red? Nobody like us. I mean, what's wrong here? So, and then you can dive into the detail. Maybe that's the reason why we're not doing well in customer service.
Yeah, I think standardization, in this particular case, we went to a standard format. And I'll be honest with you. Let me go back real quick to one of the pictures. A lot of times what you'll see, and I don't have an example in this. Yeah, over here on the right, this administrative, this may be a call center. I don't know if it's an IT project, I don't know what it is, but they went to color-coded pens. And again, whenever you can get to a simple, it could be something as simple as for that day, not even putting the value there where we red or green. And that it gets back to your design and talking with your leadership. You know, you always want to have the information available to go into, but you can simplify, you know, and the design of the board may look differently. This healthcare one down on the right-hand side, they're using some type of control or run chart there, but they have two sections, red and green. And you can see like this top one here, the chart is in the green the whole time. So how you design, there could be different approaches to optimizing the display of the information to make it a little more, you know, usable on a daily basis.
Especially making it visual, right?
Visual is always better. And
Easy to review, easy to understand.
red, that's why, you know, red or green, if you see a trend of red, ask the question, is this going down or up, and what are we going to do about it? If you see a trend of green, you ask the question, hey, that's an opportunity for best practice sharing. Are they, you know, they're sustaining great performance here. So, you know, anytime color coding, now this is a very controversial, I'll say this and then we'll wrap up on this, but the inclusion on those charts I showed, we used a run chart as opposed to a control chart. There was a lot of a senior leader. We lost a battle on that because I felt, we always wanted to use control charts where possible to give you more valuable information. But the senior leader just wanted to be able to say, for our system, are we trending up or down? Are we on track? And so we compromised in that case. So that's where your relationship and skill building, that doesn't mean you don't have a control chart behind that to share and evaluate with your team. But the good news is we won the battle or won the war by being able to have huddle boards displayed, and we gave up a little something by giving him something there. So it's just an opportunity to have a good relationship and,
The one issue with the control charts, too, I've seen a lot of companies, basically determining going with a run chart or maybe even a histogram if they're looking at their process capability. Not that they didn't use the control chart, but one of the issues with the control chart is unless you really know what your specs are, you're not just visually, you may not be able to tell if we're hitting our goal. We might be in control, but if we're out of spec, right? If we're not meeting our customers' requirements. So if our control limits are outside of our customer specification limits, then that could be an issue, and that might be an issue that could occur.
Right. Hey, Tassos, I know we're just a couple minutes over. There were a couple questions in the comments. Could I address those real quick?
Yeah, of course. Of course. If you guys can stick around, and like I said, we will try to send you or at least put a link out for, we've taped the session. Sorry, I hope you know that. So we'll try to get that out to you. So if you'd like to review it again, we'll provide a link for that. Okay.
Yeah, and I tell you what, Tassos, I'm going to send you the mini version, the promo version that I think you've seen before, and I'm okay with that. We can send that version out because it's the top line points from this. But if you're going to have the replay of this will be available. That's the first question was about in a COVID world, and I mentioned that. I've talked with a number of companies, and I've talked with a lot. Business transformation is a huge opportunity here. The current state is the old way. Then came COVID, furloughs, distancing, coming back. Right now, we're in a morphed current state. The future state is what's yet to be defined, and that's where I believe this has a lot of applicability. Again, looking at those system or those overall strategic goals, tactically, how do you deliver that, and how do you track the metrics that are going to help you deliver that future state vision? So absolutely. And then that whole piece about virtual, you can set up that board could be set up on SharePoint or through Zoom or GoToMeeting, and there's a lot of ways that I think you can set up and accomplish that. And we're gonna, like Tassos said, he's going to share the recording of this. Had a question from Harp06 here. I'm working with optical companies and would like to do this with those individual locations, but I'm seriously starting from scratch. So I'm happy to have a discussion offline with you too. And I'm sorry, because I don't know, who is that? If you, Harp06, can I have a name just so I can look for you to reach out to me?
Or if we give you, well, if we share your contact information, they can also, William Harper, so they can reach out to you directly as well.
Right.
Okay.
Right. Let's see. Oh yeah, I did. David mentioned here about customers and stakeholders. Yeah, absolutely. Your stakeholder analysis and building relationship there. Your sponsors, champions, team leaders, functional leaders. Absolutely determining that whole process is absolutely important. I'm glad somebody mentioned agile here, because I've talked with and we're all, especially those who've either been studying for or going to be taking the PMP exam for the end of the year here. Next year the whole exam process changes over and there's a lot more. I'm not still exactly what it is, but there's a more agile approach to things. But um, the bottom line is when you, whether it's, again, Six Sigma or project management control phase, or in an agile, particularly this Huddle board, the process is totally applicable in an agile environment because you're coming together more frequently. And it may be, that could be your dashboard to be able to have that discussion as you, as you talk each day, each shift, or whatever it is. So absolutely. Anybody else working with Agile at this point and any comments about that and if it could be applied?
I'm going to a meeting in an hour about it with the PMP chapter. So,
Mhm. Any other questions? Okay. Well, again, we appreciate you being here today. Thanks again, Stu. Really appreciate you being with us today. I'm sorry. And we'll try to get you some feedback. If you're interested in learning more about this, or give us your feedback about, like I said, we are thinking about making this a standalone course offering. Let us know. Send me an email. Let me know your thoughts on that. Okay. But we want to thank everyone for being here today. Enjoy the weekend. Weather should be fantastic. And keep in touch. Like I said, we'll get the link out, like we said, and we'll get Stu's contact information for you as well. So feel free to reach out to Stu as well. Okay. Everybody, take care, and thank you again for being here. And we'll get you information on the next one coming up in October. Okay. Everybody, take care.